Hi, everyone. Thanks for joining the call today. We will get started with our webinar. Thanks for joining the Asthma Self Management Tools webinar. My name is Arden Caffrey from Esperanza Community Housing Corporation in South Los Angeles, and I will be moderating today's webinar. Before we begin, like I said in the chat, we're going to start off with some logistics. So everyone on the webinar will be muted throughout. If you have any comments or questions during the presentation, please use the chat box and send a chat to all participants. That's not the default, so make sure that you click the drop-down menu and choose all participants, because if you send a direct message, the presenters may miss it. The webinar is being recorded, so you can watch it back again in the future if you wish. At the end of each webinar, including this one, there will be an evaluation that pops up in a separate window. Please take a minute to fill out that survey so we can make each webinar better than the last. Thank you in advance for doing that. So this 6-part webinar series was developed out of the Asthma Management Academy, which is a professional development opportunity developed in 2016 by the California Department of Public Health, Esperanza Community Housing Corporation, and Comité Cívico del Valle for community health workers and health educators to learn participatory national asthma guidelines-based education to encourage asthma self-management education and prevention with their clients with asthma. There will be 6 monthly webinars starting today, February until July 2019. We will host these 1-hour webinars on the 2nd Tuesday of each month. Our webinar topics were chosen and prioritized by the Asthma Management Academy participants, including many of you all, so thank you. And will include pulmonary function testing, reproductive health and asthma, and healthy homes, among some other topics. Each month, we will hear from both a clinical and a community subject matter expert. The presenters will have time for questions and answers at the end of the presentation. And again, if you have a question, please put it in the chat box. Our topic today is, of course, Asthma Self Management Tools, and we will be hearing from Monica Buenrostro, a registered nurse who has worked with the Los Angeles County and University of Southern California Breathmobile for many years. As our clinical subject matter, she is our clinical subject matter expert, and then Alejandro Vasquez and Cassandra Castro, who are community health workers with Comité Cívico del Valle in Imperial County, as our community subject matter experts. So let's get started. Give me 1 second to take control, and we will start going through the presentation. I apologize for our technical difficulties. It'll be 1 second. And someone just typed in the chat box. Can someone talk? Can people hear me right now? Ashley, can you hear me?
We can hear you.
Yes.
Okay.
All the presenters are unmuted and everyone else is muted.
Okay, great.
An array of
So actually, I'm having trouble switching. Here we go. All right. So these are the webinar times and topics. So as you can see, as we already said, it will be the 2nd Tuesday of every month at 11 a.m. Pacific time. Interestingly and excitingly, we have some people from other states. So if you are not on Pacific time, it is 11 a.m. Pacific time. And here are some of the topics that we will be discussing. So our agenda, again, my name is Arden Caffrey from Esperanza, and then we'll talk about self-management tools in a clinical setting. That will be Monica, and self-management tools in a home visiting setting. and that will be Alejandro and Cassandra. And then at the end, we'll have some time for question and answer. So I'm going to hand it over now to Monica Buenrostro. She is going to be our subject matter expert for clinical settings. So Monica, welcome.
Hi, good morning, everybody.
So Monica has worked for about 20 years in asthma management. She's worked with the Breathmobile and recently transitioning to a less mobile setting.
The clinical setting at the Valley County USC Medical Center.
So she has a lot of experience working with asthmatic patients and has cultivated relationships with various home visiting programs operating in LA. So welcome, Monica.
Thank you. Good morning. Yes, I've been working with patients with asthma and allergies for almost 20 years now, and I have seen so many changes with our patient community that we see, increasing the quality of life by teaching them what asthma is, how the medications work, and all that good stuff, even the tools and the knowledge to better self-manage their asthma and their allergies. There's 3 different kinds of asthma. We have severe asthma, moderate, and mild asthma. And also we have asthma that's persistent throughout the entire year. And then we have intermittent asthma that patients only have asthma symptoms when it's either cold or when it's hot or when they get sick like a cold or get the flu and what have you. And we do the asthma control test on patients, especially on new patients, because we want to see what their assessment of their asthma symptoms are, if they really understand what asthma is, and also teaching them what their controllers and how they think their asthma is being managed with their primary doctors, or if they come in as a new patient, what their assessment is. And this tool helps the physicians, the care providers, understand more what their knowledge base is on their asthma symptoms, if they truly do have asthma or not have asthma, and so forth. And with Asthma Control Test, it's a diagnostic tool to help the patients kind of grade their asthma as far as like their assessment of controls, their symptoms, how often they get their symptoms, when they get their symptoms, and how to take the medication, and which medications to take. And when the doctor uses the Asthma Control Test, they look for any medication changes that have improved or not aid them in their asthma control symptoms. And how does this help bridge the gap between clinical asthma care and home visiting models? The AST test shows the patient their perception of the control versus what is really going on with their asthma symptoms. Clinicians can use this to recommend medication changes at home for home visits. And they can also focus on assessing their environmental, their home environment, and see what causes their asthma triggers, whether it could be allergy to dust, to mold, dog, cat, what have you. And we do skin testing, and we can assess what they're allergic to. And once we know what they're allergic to, then we take the necessary steps to help control their allergy symptoms, which in turn will control their asthma symptoms. And other tests that doctors can use to understand the patient's asthma controls. And it's a diagnostic tool that we use for patients when they come in, just spirometry lung function every time they come in. So you can gauge and see how open or how closed their airways are as to determine their control or loss of control of their asthma symptoms. We also do a new test that we call the FeNO test. That one's going to show us how long the patient has had inflammation in their airways. And also will let us know the patient has been compliant with their medication or not been compliant, because they can say, I've been taking my medication every day, I'm not improving, and then we do the FeNO test spirometry, and that shows a different picture of what's really going on inside the patient's lungs and their airways.
And Monica, these tests would be something that a home visitor can do, or they're something that a home visitor would encourage their clients to do in a clinical setting?
Well, outside of clinical setting, they can use a little device called peak globe device, and that shows us the same thing as the spirometry. Not so much the FeNO testing, because FeNO is going to show us if it's had any inflammation in the last 3 months, 6 months, what have you, or since the last visit that we saw this patient. So the closest test they can do at home without in a hospital setting or a clinic setting would be the spirometry, which is a peak flow meter device. Okay. This is a peak flow, and this is the peak flow. We teach the patients how to use the peak flow. They're going to, every morning when they wake up, they're going to blow into their peak flow device. They're going to do 3 good blows, and they're going to take the highest number from those 3 blows, and that's going to be their morning peak flow number. Then they do it again at night, in the evening, and they're also going to blow again 3 times, and the highest number from those 3, the highest reading, that's going to be their peak flow number for that evening. So they can gauge it, and they mark it on a daily peak flow meter diary on a daily basis. So when they come to the doctor's appointment, the doctor can see what their flow meter diary is, and then we'll let them know that you can step up treatment, continue treatment, or you can decrease their medications, or even suspend their medications. And sometimes this usually happens during the summer for some patients. And the number trends will show the doctor if they need to make any medications, step up, continue, or decrease their medication dosage. And how does this help bridge the gap between clinical asthma care and home visiting models? Well, once we identify the allergens for the home visit, and the home visits can help identify and also help us better teach the patient understand that the allergy triggers will trigger their asthma attack. So once we can control the environment and find out what they're allergic to, we can take the steps to teach them to avoid and control their environment, whether it's dust mites, mold, cats, dogs, different kinds of grasses, weeds, or trees, like that. And then after this, the peak flow meter diary also helps the patients, allows them access to find out and understand what's really going on in their lungs, in their airways on a daily basis. It gives them a tool, gives them a little more control so they can see what's really going on, and they can assess their asthma and understand that when their asthma is getting worse, they're going to step up their medication. And this is what we have. This is when we have the Asthma Action Plan. It's going to teach the patients what to do when they're in the green zone, the yellow zone, and the red zone. This is another tool that patients understand. It's like a little what to do in case of. So when a patient we identify, it's like we teach them their Asthma Action Plan. It's like a street light. We have your green zone, the yellow zone, and the red zone. Ideally, you want to be in the green zone because when you're in the green zone, that's when you're doing well, you're not having any asthma symptoms, your breathing is good. You can continue with the activities of daily living without any issues of asthma and such. We usually identify the controller medications, which could be like your Q-bar, Flowen, any other medications that help control and prevent your asthma symptoms. And also included would be your albuterol, your respiratory inhaler, that you're going to take when you have asthma symptoms or 20 minutes for activity or exercise. And then we teach them also when you're in the green zone, we start to drop into, when you're in the green zone, it's also going to show you when you're going to have your peak flow numbers. This is also a tool that doctors give the patients so they know when they're starting to have asthma symptoms or where their peak flow numbers start to drop a little bit, that's when they got to step up their medications, their controllers, or increase their respiratory inhaler, their albuterol, increase the dosage. So when we tell the patients, okay, if you see that you're starting to slip into the yellow zone, where you're having wheezing, coughing, shortness of breath, you're waking up at night wheezing or coughing, you're going to step up your medication. And each asthma action plan is customized for each patient. It's individualized. The doctor's going to increase their medication either like 2-fold or maybe like instead of taking, for example, the Q-bar 2 puffs once a day, you're going to do 2 puffs twice a day, even up to 4 puffs twice a day or what have you. Every plan is individualized for each and every patient. And you're never going to stop your albuterol. If you start falling to the yellow zone, you're going to get albuterol. You're going to increase your albuterol usage to help try to push you back into the green zone. What we don't want to happen is you fall into the yellow zone, you slip into the red. That's when you're really, really bad. With an emergency, it's time to call 911 or get to the emergency room as soon as possible. And when you're in the red zone, you're going to increase your albuterol usage. You can take 2 puffs every 20 minutes or at least even like 3 times until the ambulance gets there or until you get to the hospital. And usually when the doctors give the patient the Asthma Action Plan, they also give them prescribed prednisone, the steroid. And they're going to have that at home in case they fall into the red zone. They're going to increase albuterol usage while they get to the hospital or call 911 and start the prednisone immediately.
And Monica, when you worked with the breathmobile, even now in the clinic, do you guys give these asthma action plans out, or can they get them from other sources?
No, every patient that comes to every visit that has asthma will get an asthma action plan and be updated on every visit. And what is the function of asthma action plan? It's like it gives them a tool, gives them a little bit of control as to see, so they know what to do in case of. It's like a little, like in case of emergency, what you do. So you want to teach them that you want to stay in the green zone where they're doing well, they don't have any problems, asthma symptoms, not urgent care visits, and ending up in the emergency room. So you give them the tools and the understanding of what to do to avoid going to the emergency room or to the urgent care or getting really, really bad, missing school, parents missing work. So also reinforcing compliance with their medications. They know they're taking medications on a regular basis, teaching them, even though they're inhalers, whether it be controllers to help prevent asthma symptoms or their emergency and rescue medications, they need to understand which is which. Even though they're all inhalers, you need to understand this one's to help prevent and control your asthma symptoms. And this one is only when you're having asthma symptoms, or you're going to take it 20 minutes for activity, exercising, or anything like that. And how does this help bridge the gap between clinical asthma care and home visiting models? This asthma action plan is a tool that the patients can use at home, and also helps the doctors encourage the medication compliance with a treatment plan. And other tools that we give the patients for allergies and nasal to help control their allergies, which if we control their allergy symptoms, it'll be, if we are better able to control their allergy symptoms, we're better able to control their asthma symptoms because we're avoiding their triggers, which causes their allergies, which in turn will trigger an asthma attack. So we just teach the patients how to use the nasal sprays also. We teach the patients how to use the medication correctly. It's not just to prescribe the medication, but also to teach them correctly how to administer and why you administer a certain way. Like, for example, we have this diagram here, the nose of the sinuses, and this is how we teach the patients how to use the nasal spray correctly based on the anatomy of the inside of the nose. So once they see this, they understand why they use it this way versus, because sometimes they come and they already take nasal sprays, but they use it incorrectly. So the doctors are on the right track. They're primary doctors usually. They're on the right track, but we just have to fine tune it so the medications work correctly and how they're intended to be used. And this is just other tools that we give the patients about asthma. They have it in English and in Spanish, and little tools we give to the children so they can better understand what's going on in their airways, what asthma is. So these are little helpful hints and things that we give our patients, little tools. And any other questions? So
we'll respond to questions.
Okay. Okay. Yeah, this is our contact information. You can contact me at my work email address. It's mbuenrostro@dhs.lacounty.gov.
Great. So thank you, Monica, for reviewing the Asthma Control Test, the peak flow meter, and the Asthma Action Plan, among many other tools. So I would like to ask you a question. Are there any experiences you've had with different patients that can sort of show how these tools help controlling asthma?
Yes, I think the ACT tool is a very important tool for the patients because it gives them a better understanding of what's going on, and they can better gauge their asthma symptoms, whether they have control or not as well control.
Yeah. Okay. And did you see the use of these tools a lot in your experience on the breathmobile and now in the clinic?
Yes.
Okay.
Yeah, I saw a lot of that on the breathmobile and stuff.
Great. Well, thank you so much, Monica. We will now hear from our community subject matter experts from CCV or Comité Cívico del Valle, Alejandro, Cassandra, and Esther.
Good morning, everyone. Thank you so much for inviting us today. We're thrilled to have the opportunity to share a little bit of the work we are doing in our community and how community health workers are empowering patients to take better control of their asthma. My name is Esther Bejarano, and I am the Health Programs Director for Comité Cívico del Valle. I have been with the CV for over 50 years. I'm also the coordinator for the Air Quality School Flag Program in our 25 schools in Imperial County. We are a grassroots nonprofit organization dedicated to serving the needs of our overburdened and environmentally challenged communities with advocacy, health education, policy, and civic engagement. And we would like to take this opportunity to thank Asthma Management Academy, all of the team, and Esperanza Community Housing for offering these very important webinars. I will now share a little bit of our past and present work. Most recently, we worked with SDSU with the Respira Sano Healthy Breathing Asthma Research Study, and I'm excited to share that our community health educators you're about to meet are very dedicated and worked with over 700 families and provided over 750 home visits on asthma self-management and education. We're currently providing evidence-based education in the home environment that consists of indoor and outdoor environmental assessments, asthma device teachback, along with trigger remediation. We also feel it is vital to have a very close relationship with our community schools. We have helped implement, as I just shared, the school flag program in many of the schools here in Imperial County. Well, a little bit of where we're at. We're located in Imperial County. For those of you who don't know where Imperial County is, we are 2 hours east of San Diego. We have a desert basin, and we are agriculture farming community along the U.S.-Mexican border. You will soon hear from our great team. They will discuss how enhancing the education that patients receive at the clinical setting and then bridging that education to the home setting is vital for our asthma patients. With that said, I would like to introduce our team of home educators, Alejandro Vasquez and Cassandra Castro. Take it away.
Thank you, Esther. Hello, everyone, and welcome. My name is Alejandro Vasquez, and I'm a community health worker. And I'm happy because today I have the opportunity to talk to you all about some of the tools we have used and seen in the community. Just to give you a little bit background on myself, I've been working for Comité Cívico del Valle for about 4 years now. I've been involved with a few local asthma education programs for the community on one-on-one education and group education by participating in community health fairs. Besides asthma education, I have also reached out to educate community in healthy homes, environmental health, and sometimes advocate for the patient's needs. Cassandra?
Hi everyone, my name is Cassandra Castro, also a community health worker with Comité Cívico del Valle. I work directly with families to manage their asthma in home-based education as well.
All right, next slide, please. So I'll be talking a little bit about the peak flow meter and what we see in the community over here in Imperial County. So you know, peak flow, it's a great tool at home, office, or at school. That many patients are not aware of its benefits of having one. We as community health workers must make sure each patient has a full understanding of the right way to use the peak flow meter and the benefits in achieving a better asthma control. We also explain the patients that the peak flow is it's a great way to measure in numbers how well air moves out of their lungs. Peak flows are a great way for patients to recognize early changes in the airways caused by inflammation, constrictions, and or over mucus production. With the help of the peak flow, an asthma episode can be prevented. If the patient has a peak flow meter with their personal best numbers in their asthma action plan, all provided by the medical doctor, we show our patient how to correctly use the peak flow meter. Patients must be seated or stand up straight before blowing into the device. They must fill their lungs with air and blow as fast as possible in the peak flow meter through their mouth to move the indicator. Simply by blowing into the peak flow, patients can see how their airways are doing. The indicator will let them know their zone and their actions according to their asthma action plan. When patients do not have their personal best numbers, we educate the patients to get their average number as per the manufacturer peak flow recommendation average numbers. And this is based according to the patient's gender, age, or height. We always recommend the patients to get their personal best numbers by using an asthma diary because these numbers are more reliable. Now, some of the challenges that we have seen with the peak flow is that it is very uncommon among the patients when we do a home visit. About 1 to 5% of the patients that we educate have one at home or at school. It is common to see that in the community, many medical providers do not prescribe one to the patients, mainly because according to the statements from the patients that we visit, is providers don't see a need that the patient might use or benefit from the peak flow. Now, some of the successes that we've seen locally is that some local programs have helped patients receive a peak flow. After education, patients are able to correlate the importance of having one and their asthma control. Adults are more able to understand and use the peak flow meter quicker than the children. Next, I still have the asthma diary here. So the asthma diary is another tool that we educate the patients for better asthma control. Asthma diary, it's recommended to be filled out, like Monica said, to be filled out every year, and usually most of the asthma diaries will have the option to record symptoms, peak flow readings, and medication for about 2 weeks. In order for the patients to get their personal best numbers, we ask the patients to fill out their asthma diary. We educate the patients to record their numbers for 2 weeks, non-stopping, when their asthma is well controlled. Patients must record their peak flow reading 2 times every day by simply blowing into the device three times and recording the highest of the 3, and then repeat the process at night or in the evening. If the asthma diary has the option to record their symptoms, we encourage the patients to record any symptoms in the asthma diary as well as their medication use. After completing their 2 weeks straight, we ask the patient to take their complete asthma diary to their medical provider, where there they can work on their personal best numbers. Now, some of the challenges that we see over here with the asthma diary is that patients usually do not fully complete the 2 weeks due to the length of the asthma diary, and then local medical providers do not attribute or give the importance of using an asthma diary. Another challenge is that patients must have their asthma well controlled in order for them to fill out the asthma diary, which in return, patients like to do the asthma diary because they're feeling well and they don't see any interest in filling out the asthma diary. Now, some of the successes about the asthma diary is that when a patient fully and honestly completes the asthma diary, we have seen positive control in their asthma. Patients are more aware of how their airways work and the effect of medication and environmental triggers towards their asthma control. Usually children fully complete their asthma diary than adults because children have the support from their parents and siblings, and adults sometimes they lose interest in filling out that form for about 2 weeks. All right, so back to you, Cassandra.
Thank you, Alex.
I think it's next slide.
Next slide. So the Asthma Action Plan has been a great tool for community health workers to provide a better understanding on patients regarding on how to manage their asthma in home basis. This tool has given us the opportunity to explain more in depth why it's so important to have an asthma action plan and follow its instructions. The Asthma Action Plan is very helpful because patients can identify in which zone they might be, symptoms, and consequently, which medication they should take at that moment. This form, with personalized instructions to control asthma, also makes them remember what each medication is for, we help patients get a clear understanding of the differences between a quick reliever and a controller. This is a great tool to manage and control their conditions, but also a way to know when to seek for help, like call 911 or go to the ER. Our goal as CHWs is to patients have a better understanding and knowledge of the Asthma Action Plan form, along with their medications. When we associate the zones of the Asthma Action Plan with the traffic light colors, we create a meaning for each zone, which makes it easy to patients related to symptoms and medications. The provided colorful Asthma Action Plans help us to create those connections. We have seen that patients have a better understanding when we use as an example of their own asthma action plans and their prescribed medications. As community health workers, we have encountered some challenges while performing home visits because some of our patients have never had an asthma action plan before. It is very common to see patients, caregivers, children, and school nurses without an asthma action plan to follow here in our community. However, those who come with one sometimes don't even know what it is or what is it for. During or after our educational program, patients gain the knowledge on how important it is to have an asthma action plan or requesting one from their doctor. With our experience within the community doing home visits, families and patients have told us that some providers charge for each copy that patients request. They have also shared that some providers have expressed to them they don't even know how to fill them out, or that they don't use them at all. As experienced within our past programs, our community clinics have provided asthma action plans, but one of the challenges that we're still seeing is that we are not provided in a colorful version. As I said before, a colorful asthma action plan helps us illustrate and deliver a well-explained education that permits patients grasp it in an easiest way. Another barrier that we have encountered is that some of the asthma action plans that we have seen do not match with their currently medication, result on a non-updated asthma action plan. As a community health workers, our priority is to create awareness of all this information and to encourage patients, families, advocate for their own health. But this could only happen if we work in collaboration to attend the needs of our community. Thank you. So, Alex?
Thank you, Cassandra. Next slide, please. All right, so some of the tools that we locally use over here in Imperial County is, for example, this Respira Sano activity book. We as community health workers use this book to make sure our education process is more effective and engaging with the patient. This book has a comprehensive education material for children and adults, along with activities to reinforce the learning. It is also available in English and Spanish for easy access and understanding. The activity book covers asthma information such as the what is normal breathing, spirometry, and the peak flow meter, asthma medication, differences of asthma medications, asthma triggers, the Asthma Action Plan, and we cover a little bit of the local school flag program that we do, and throughout that booklet we reinforce regular doctor visit for a well asthma control. Activity books such as this comprehensive tool helps patients go back and reinforce community health workers' educational materials. Next slide. And then the other tool that we use locally is the home environmental observation, which is it's a great tool for patients to keep. We usually provide a copy to the patients after we do the home visit. This tool contains recommendations after we do a walkthrough in the home, of course with the patient's consent, and we cover possible indoor and outdoor environmental triggers. The community health worker walks along the patients in the home visit, giving recommendation of possible triggers that might be present at the home and affecting the patients. The home environmental observation covers three important objectives. One is assessing the home, the whole structure of the home. Second is assessing the indoor environment, where we cover some of the rooms, for example, the kitchen, the living room, the bedrooms, and then we make notes and give recommendations as we go along. And then we assess the outdoor environment. Right here on the outdoor environment, we try to cover some of our local triggers that we might see, for example, field burning, empty lot, dusty lots, heavy traffic, and we try to give recommendations on how to mitigate those triggers with the patients. It is always, as I said, it is always recommended to leave a copy because that way patients can go back later and see the recommendations that we provided. And it's also very important to create this interpersonal relationship with the patients because that will make the conversation more reliable, and we'll be able to share ideas openly. And then at the same time, we'll be able to discuss possible asthma triggers that might be affecting them, and which are the best practices to avoid them. Thank you. Back to you, Arden.
Next
Great.
slide.
So we have the contact information up if you would like to contact anyone from CCV. Thank you, Alejandro, Cassandra, and Esther for discussing the peak flow meter, the Asthma Action Plan, and other tools. It was really interesting to hear about your experiences with patients in the community. So we do have a couple questions from people who are attending the webinar, and then we have a couple questions ready, so we'll start with those now. So we'll just start with the first question that we got. So this is I assume it's for Monica. So even if there are no changes on the asthma plan medications, do you still provide a new asthma action plan for a patient at every visit?
Yes, each patient gets a new asthma action plan every visit, just to kind of reinforce the plan and make sure the patients are following the instructions from the doctors, and they're also adhering to their the treatment plan that the doctor prescribed.
Great. Thank you very much. And I think this next question that just came up is going to be for CCV. So what are some of the recommendations you can give for surrounding traffic, et cetera? So I assume outdoor air quality things that your patients are struggling with their asthma.
Yes, I mentioned working very closely with schools. So some of the recommendations is always making sure that you are registered to receive alerts. Communities have air monitoring stations that are recording air as we speak based on the Clean Air Act. And so we make sure that we educate not only the staff in the school with our school flag program, but the nurse and making sure that she is checking the air quality. They check it 3 times a day before the school, before recess, during lunch, and then after school if there's after school activities, and then so they're able to modify activities or reduce exposure. So if it's a school day schedule, kids have to stay indoors. And so we share that not only with the schools but with the community as a whole. That's one of the recommendations, but there's many.
Thank you. So Alejandro, I had a question for you. During your, while you were speaking about peak flow meters, you said many patients don't have a peak flow meter and a peak flow diary. Do you encourage them to ask their provider to give them one, or how do you go about that conversation to encourage your patients to actually use that even when they're feeling fine and have their asthma under control?
Actually, once we're on the home visit and we see they don't have a peak flow meter or an asthma diary, we always refer them back to the medical doctor, to the primary care provider. But this is the thing locally. Providers they don't give the importance of a peak flow. So when we go back to the families, they say, well, my doctor said that I don't need it, so it's not recommended for me to use it. And then to resolve some of those issues with some of the local programs that we had over here, we were able to provide some of the peak flows and educate the patients how to use it correctly, and still make sure that they work together with their provider to get their personal best numbers. If the providers they don't know how to use or educate the patients about the peak flow, we try to refer the patients to local providers that might be able to assist them. But sometimes for insurance purposes reasons, I mean they can't change provider very easily. So we work with them so that they can at least get their average numbers instead of the personal best numbers.
Great, thank you. And so I'm not sure who the next question was directed at, so I guess we'll ask it both for our clinical subject matter expert and our community subject matter experts. So I guess we'll start with Monica here. How often are the follow-up asthma visits done?
Well, when I used to work on the breath level, we used to have the follow-up visits would be anywhere from 6 to 8 weeks. So we follow them continuously throughout the whole year. With the clinic patients, it can vary. It depends on severity of the asthma, how they're well controlled or whatnot. So it can be anywhere from 2 to 3 months, even 6 months to some patients. But as a rule, it's usually about 6 to 8 weeks on the mobile, depending on how they're doing. It does some patients. If their asthma is less severe and less they're well controlled, then we can increase it to, further down the road, like 10 weeks or what have you. But some of them need to have a little bit closer monitoring because they need to be better taught and control compliance. They need to be better taught on medications. We've got to make sure they bring the medication every visit. We review, and really make sure that they're complying with their medications, that they truly understand their Asthma Action Plan, and they do what they need to do to have better control of their symptoms for better outcomes.
Great, thank you. CCV, do you guys also have a sort of a timeline for how often follow-up asthma visits are done?
Yes, Arden. Basically, we do usually it's 4 home visits that we do. Every home visit it's provided within 1 hour and 1 hour and 30 minutes. And the distance between each of the home visits depends mostly on the patient's availability time. Usually it's every 2 weeks that we do between every home visit. Now, one thing that we do is that we assess some of the programs. We assess the knowledge of the patients. If we see that there might be the need for an extra home visit, we go ahead and schedule an extra home visit. But if we see that the patient is getting all the information and everything, we should be done with the whole 4 home visit in about 2 months.
Great, thank you. So the next question that we had that came up, if there are values of spirometry tests done at the provider visit, do you still use the peak flow meter? So we'll ask both subject matter experts. We'll start again with Monica, and then we'll go over to CCV.
Yeah, okay, so the spirometry, well, what a peak flow is basically a spirometry test that they can do at home. So they can kind of gauge their numbers, because on every visit we do spirometry testing. So we're going to see how open or how closed their airways are, how much inflammation is happening inside their lungs. So yeah, we definitely encourage the peak flow meter so they can gauge what's going on with their asthma, and they can, using their peak flow meter and also the Asthma Action Plan, will gauge what's going on with them, and if they know that their peak flow numbers are dropping, that they got to step up their Asthma Action Plan, they have better outcomes, better control, and better understanding of what's really going on. So it gives them a tool and the knowledge to increase their medications or whatnot. So it gives them some better understanding and control of their asthma symptoms, so they know what to do in case of. And okay, back to you guys.
Great.
So Alejandro, anything to add on your end?
Can you repeat the question again?
So if a patient or a client already has a spirometry test done at their provider visit, would you still use the peak flow meter in the diary?
Usually, if they have the peak flow the personal best numbers from the provider, we use those numbers at their home visits. If they don't have any, we use the average numbers recommended by the peak flow meter manufacturer recommendation numbers. But we always try to work with the patients and the providers so that they can get their personal best numbers, because those are the most reliable ones.
Right. And the peak flow meter they can use at home continuously, so it will look at their sort of day-to-day control of their asthma and how they're doing over long term. So even if they have spirometry numbers, it's good for them to keep assessing their asthma control in a way that's easy to do at home. Great. So I guess, Monica, we'll ask you the next one. Do you know does Medi-Cal cover the peak flow and printed materials, or CCV if you guys know, and does a patient need a prescription for a peak flow meter?
Typically on the Medi-Cal end, I'm not sure if they cover or not, but for the most part here at the hospital, we usually give them their peak flow meters. Usually we have plenty of peak flows. We give them to our patients. On a rare occasion, if we don't have, they'll prescribe like a peak flow, also their spacer and stuff for their medications and such. So, sometimes we need a prescription. It depends on their plan if it's going to get covered or not. And if it doesn't get covered, then we work around that and stuff. We can find a place or a way to try to get the medication, their devices to them, whether it be a peak flow meter or their aero chambers for administration of their inhalers.
Right. CCV, any response to that question? Have you guys had experience with patients getting their peak flow and printed materials covered by Medi-Cal?
Hi, Arden. And basically, we don't exactly know if Medi-Cal covers it, but what we've seen on the home visit is just minimum people that have peak flows. I would say between 1 or 2% of the participants have a peak flow. And usually, the programs that we have over here, we provide them with the peak flows according to the program. But once the funding ends, I mean, we're not able to provide any more peak flows. Most of the recipients over here in the Imperial County are Medi-Cal users, so I don't know if it's part of the coverage of the insurance, or it might be just the providers that are not giving those devices to the community.
Right.
Okay. All right, so the next question, is this type of home-based asthma education good for children through seniors? Are seniors asked to do peak flow? How do they react to doing this at home? So this is mostly a CCV question, I believe. So is home-based asthma education good for all ages? Do you ask everyone to do a peak flow, children and adults included, and how do people generally react?
Yes, basically, all of the programs that we have over here are for children, adults, and seniors. All the materials, it's directed to any age. Almost everyone reacts positively to the program. At the beginning, we have to explain the patients the benefits of the program, because they might be resistant in having someone over their house. But once we do the initial contact and explain them the benefits, we see that the absorption of information in the program it's well for children as well as adults and seniors.
Great, thank you. So this will be for both Monica and CCV. Have you guys had an experience where a patient adopted the asthma management tool? And what were some of the challenges that you had to overcome?
We've done pretty good actually with our outcomes with our patients and getting the treatment plan, their asthma action plans, and any material, and their devices, their spacers, and their peak flow meters. We really haven't, in my experience, I haven't really encountered too much of a difficulty as far as getting the patients the necessary tools to help them manage their asthma. At the hospital, we give them their spacer devices, whether it be for children or adults or what have you. So we're able to help them out in that way, so they don't not have the proper tools to manage their asthma. And also, we can give them the peak flows also from the medical center.
CCV, any experiences with patients adopting the asthma management tools, and any challenges that you have had to overcome?
Yes, Arden. One of the I actually had a patient that saw the benefits of the tools, and I'll explain the challenges that we saw. But just to give you a little bit background, Imperial County, it's along the border between U.S. and Mexico. So this specific patient, they had insurance that was covering medication and all the treatment and everything, doctor visits in Mexico. So when we and they were living over here in the Imperial County. So when I was giving the education to it was a child, but the mother was involved also into the education process. He wasn't well controlled. He wasn't playing any sports. He wasn't doing any activities because everything that the child was being exposed to, he was having an asthma episode. So this was one of the most intensive education that we did, because we had to work with their provider in Mexico and then try to educate the family on the medications and the tools. So at the end, when the patient was on the right medication, using the right tools, using the asthma diary and the peak flow, I'll say that 2 months after the initial encounters, the child was already in sports. The child was enjoying soccer. He was doing a lot of activities. So we've seen that these tools work. It requires attention. It requires dedication from the patients and the providers, but they do work. We've seen improvements on the patients.
Great, thank you. So we have time for just a couple more questions. So for CCV, how do you think health educators can do, what do you think health educators can do to best prepare to help their clients learn and adopt asthma self-management tools? And as a piece of that, what are some key questions that you encourage them to ask their provider when discussing their self-management tools? So how do you sort of support them in advocating for themselves?
Yeah, one of the, we try to give confidence, we try to advocate for the patients, but at the end, all the power lands into the patients, right? So at the same time that we're educating, we tell them that they're the ones that they're supposed to be going to regular visits to the doctor. They're the ones asking the questions. They're the ones that need to take advantage of those 15 minutes with the doctor and also ask all the questions about medications. And that kind of education and advocacy that we do for the patients and empower them to take advantage of that doctor visit. There's patients that only go once a year to the doctor and they're in medication. So we encourage the patients to go frequently to do the spirometry testings with the doctor, request allergy testings also, so that they can keep track of their allergy sensitivity throughout their life. So we encourage the patients to do that.
I just want to chime in. This is Esther here at CCV. During our home visits, we also provide the family not only with the tools to better manage their asthma, but we provide many resources in our community. There's barriers of transportation, there are barriers of language, there's so many. I think we have 4,000 patients per practitioner, and so we also have look at their social determinants of health. Asthma might not be at the top of their list because they're dealing with so many other issues, and so we're not only there to educate on asthma, but we're there to help the family meet these other challenges and then refer them and help them, and then so that way they are led to the goal of managing their asthma. We've seen families when they're going through, needs of food, needs of changing apartments. We've seen families that have very hard structural needs. I know that Alejandro has had families that he's referred to clothing because students didn't have any clothes for back to school. So they're dealing with so many things. We have one of the highest rate of no jobs in Imperial County. And so we help them with these challenges, and then we lead them with the right places, resources, and then we come in to help them control the asthma. But social determinants of health is very important, and so we also teach them on those areas when we're providing home visits.
Great. Thank you, Esther. That's a great point that, you know, we see people as holistic people that have, it's not just asthma, it's a lot of other things included in health. So thank you for bringing that up. We'll do one more question really quickly, sort of a more practical one. Both Monica and CCV included some other resources that they use with their clients and their patients. Where can we get access to these different resources?
There's a website. I think it's LABreathmobile.com. Yeah, I think it's the other one is LABreathmobile.com. You get information. You can also print out your Asthma Action Plan. So when you go to your doctor, you can have that ready in hand, and the doctor can help individualize that for each and every patient that has asthma, even adults.
CCV, is there a place that we can access those other resources that you all referred to in your presentation?
Yes, and actually the booklet is available online. They can log in into, well, they don't have to log in, just go into the website. It's respirasano.org, and then they can see some of the videos that we produce, some of the materials that we use. There's even access about the school flag programs on that website so that they can get more information. And there's also some teaching techniques, how to use, for example, the pig flow. But that website has really a lot of resources so that they can see.
Great.
And along with that, Alejandro, they'll able to see videos. We have short videos on how to clean green, and so we also supply families with a green cleaning bucket and help them avoid using harsh chemicals. So there's a lot of tools on that website, and so we encourage you to go online or feel free to email us. We have recipe cards of how to clean green, and we have materials as the home environmental assessment that we'll be happy to share with everyone. Thank you.
Great. And can you print the Respiro Sano book from the website?
Yes, it's in PDF. They can download the PDF file and print it out and see all the materials in there.
Great. Thank you so much. All right. So thank you for all of the participants for joining today. We really appreciate your participation, and thank you to our wonderful presenters for sharing your knowledge and your expertise about all of these asthma self-management tools. Please fill out the evaluation. Again, at the end, it will pop up in a separate tab or window when you sign out of the webinar. If you have any questions about today's webinar presentation, please reach out to me. My name again is Arden Caffrey, and if I can get this PowerPoint to change, you will see my email, but it is arden@esperanzacommunityhousing.org, as well as any of the presenters. All of their contact information was shown during the presentation. So we hope you will continue to participate in our future webinars. There's my email. With our series. The next webinar will be on March 12th at 11 a.m. and we'll focus on lung function testing, and we hope to virtually see you all there again. So thank you so much, and have a great rest of your day.
Thank you.
Thank you.
Thank you for inviting us.